Dawn has kindly agreed to be here to help us with the demonstration of some of the key postures that are in the sequences in the other parts of the DVD. So thank you, Dawn. The first posture that we're going to demonstrate is a posture called Chakravakasana. The intention of Chakravakasana is to flatten the thoracic spine on inhale and stretch the lumbar spine on exhale. On the inhale, the intention is to stretch in the front and flatten the thoracic spine. So she pulls back on her hands and lifts her chest. On the exhale, she contracts her abdomen and rounds the low back as she moves the hips backwards and goes down. So notice the low back is stretched without the thoracic curve increasing. And as she inhales, she comes forward onto her hands, pulls back on the hands, and tries to flatten the upper back. In Dawn's case, you can see there is a congenital thoracic kyphosis. As she's exhaling, she's stretching her low back. As she's inhaling, she's flattening the upper back and stretching in the front of the body. So as you practice this, try to remember as you're exhaling, you stretch the low back, don't collapse the upper back. And on the inhale, you flatten the upper back, don't collapse the lower back. This posture is called Vajrasana. The intention is again to stretch the back on the exhale, but to use the arms and adduct the scapula to help flatten the upper back and stretch in the front of the body. So go ahead and inhale, Dawn, raise your arms. Now notice as she exhales, she sweeps her arms wide and brings her palms up, hands on the sacrum, forehead on the floor. And as she inhales, she leads with the chest, takes the arms wide, adducts the scapula, flattens the upper back, and comes all the way to the starting point. Palms face each other. And as she goes down, she sweeps the arms, rotates the palms so that they end up facing upward, hands resting on the sacrum. As she inhales, she sweeps her arms wide, pulls the scapula towards each other, stretches, and comes all the way up. And again, exhaling down, belly goes in, low back is stretching, forehead down, palms rotate and hands on the sacrum. And inhale, leading with the chest, arms sweeps wide, and she comes all the way up to the starting point. And exhale down, sweeping the arms, forehead on the floor, low back is stretched, and inhale, arms wide, leading with the chest, stretch in the front, and come all the way up. Exhale down, last time, pulling the belly in, stretching the low back. And inhale, take the arms wide, and up. Okay, and lower the arms, standing on your knees. And relax. This is a variation of Vajrasana adapted in order to maximize the stretching of the neck and mobilization of the shoulder. Dawn, please stand up on your knees, fold your right arm behind your back, and raise your left arm forward and up. As you exhale, tighten the belly, bending forward, round the low back. Sweep your left arm behind you as you turn your head fully to the right. This stretches the left side of the neck and shoulders. As you inhale, lead with the chest, sweep the right arm wide, and let the head roll to the center. As you exhale, sweep the right arm behind you as you turn your head left. Notice how she stretches the right side of her neck. Notice also that she doesn't need to bring her buttocks all the way to her heels because the focus is stretching the neck. Inhale, lead with the chest, sweeping the arm wide, that is the left arm, head to the center. And exhale, sweep the right arm behind you as you bend forward. Again, notice that she doesn't need to bring her buttocks all the way down. She's focusing on stretching the left side of her neck. And inhale, sweeping the right arm wide, lead with the chest, head to the center. And one last time, Dawn, as you bend, sweep the right arm, look left. You can see the right side of her neck being stretched. Rest there for a moment, please. And now you can sit up. head to the center, relaxing your arms. This variation of Uttanasana is adapted to stretch the back. One thing it's important to pay attention to is Scott is intentionally bending his knees in order to facilitate stretching the back, and he'll demonstrate that now. So inhale, and as you exhale, start to bend forward, bending the knees, bringing the belly and then chest towards the thighs. Allow the hands to slide gently down the backs of the legs, and then inhale, sliding all the way back up, leading with the chest, sliding the hands all the way back up. And exhale, go down. And inhale, slide all the way back up. And you'll repeat this several times and then go down. And staying down, on inhale, lift the chest, adduct the scapula, pull the shoulder blades together and depress the shoulder girdle, and sink the belly and chest towards the thighs. And we'll do this a few times. This action activates the rhomboids, good for the shoulders and upper back, and prolongs the stretching of the erector spinae in the lower back. And exhale down. And then inhale, sliding the hands all the way up as you come all the way up. And relax. This is a variation of Ardha Uttanasana adapted specifically to strengthen the muscles of the upper back, the erector spinae, and the rhomboids. Scott will demonstrate. Inhale, lift your chest, and as you exhale, begin to bend forward, slightly bending your knees, sliding your hands down towards your heels. And then as you inhale, come up halfway, adducting the scapula. Notice the elbows are bent as he comes up a little higher, halfway, a little higher. And then exhale, go back down. And he'll repeat this again. As he inhales, he's lifting the chest, but notice as he adducts the scapula, the upper back is flattened. And exhale down. And we'll do this one more time. Pull the shoulder blades together, depress the shoulder girdle down, exhale down. And then as you inhale, slide your hands up the backs of your legs, leading with your chest, and come all the way back to the starting position. And relax. This adaptation of Virabhadrasana is designed to stretch the front of the body, strengthen the muscles of the upper back, but also to alternate adduction of the scapula with abduction of the scapula to increase circulation to the upper back and to relax the shoulders. So bring your left foot forward, please. Now, inhale and bend the front knee, displace the chest a little forward, pull your shoulder blades back. Notice this position, his shoulders are intentionally in front of his hips, not aligned with his hips. Exhale, return to the starting point. So this is the first part of it. Now, inhale, lift your head up. Now, as you exhale, bring your hands to the opposite shoulders and abduct and drop the chin. And one more time, inhale, adduct, and abduct. Now, from here, just lower your arms and relax, and we'll turn to give them a better view of what's happening in the upper back. Inhale, adduction of the scapula, shoulder blades come together, head up a little bit. Exhale, come out of the posture, dropping the chin in, abduct. Notice how the scapula widened, the upper back rounds slightly. Inhale, adduct, the scapula come together and the upper back flattens. And exhale, abduct. And then just lower your arms and relax. This is a classic ancient version of Virabhadrasana. Virabhadra was a great warrior in the Mahabharata. In this version, you see the martial quality of this original posture. Here it is adapted to again energize the upper back and shoulders. Left foot forward, please. As you inhale, bend the front knee, but pull the arms back, elbows level, pushing the chest forward, fingers curled like a martial posture. As you exhale, stay in the position and slowly push your arms forward. This abducts the scapula. As you stay in the position and inhale, shoulders down and back, palms, forearms parallel to the floor, and exhale, push forward. Abduct the scapula. And as you inhale, again, pull the elbows back, shoulders down, elbows further back, palms curled, and exhale, push forward. And we'll do it one last time. And inhale, pull the scapula back, adduct the scapula. Now exhale, roll the palms down, straighten the front leg, and return to the starting position. And relax. This variation of Virabhadrasana is adapted to mobilize the shoulders and strengthen the muscles of the upper back. Please take your left foot forward. And as you inhale, raise your arms forward and up, head level, and bend the front knee and arch the upper back. As you exhale, bend the elbows, push the chest a little forward of the hips. Keep the hands a little more perpendicular. Inhale, raise the arms up. And once again, exhale, bend the elbows, push the upper back forward of the hips, keep the hips back. And inhale, raise the arms. And now we'll exhale, lower the arms and straighten the leg, returning to the starting position. Now we're going to turn and give you another angle of this same posture. Inhale, go into the posture, head level. And as you exhale, bend the elbows and push the upper back further forward. Push the upper back further forward. And inhale, raise the arms. So you can see the action of the scapula facilitating flattening of the upper back. Exhale, push the chest forward. And inhale, raise the arms. And then exhale, lower your arms and straighten your leg. And relax in this position, please. This posture is an adaptation of Utthita Trikonasana, adapted specifically to stretch the muscles that bind the head through the neck to the shoulder. Please spread your feet and turn your left foot perpendicular. Rotate your shoulders slightly to the right. Inhale and exhale. Simply slide your left hand below the slightly bent knee. As you go down, roll your head to the left and roll your shoulder, externally rotate your right shoulder. See the stretch in the neck. Now inhale, return to the starting position, the neutral position here, this one, and exhale, go back down again. Turn your head left as you rotate your right arm externally and roll your shoulder right. So you can see this stretch. Inhale back. And head to the center and exhale down. Now, this adaptation is going to mobilize the shoulder, circumduction of the shoulder joint. As you inhale, raise the right arm up, turn your head forward and look towards the hand, and your head's going to go back down as you take the shoulder back, still externally rotating the arm, head down. Inhale forward. This also stretches the latissimus dorsi and the intercostals. Exhale back, head down. You can see this nice stretch in the neck. And one more time, looking forward. And then exhale back. And now you're going to stay here a few breaths, inhaling. And as you exhale, just intentionally look further left and roll your shoulder further right. So you augment the stretch, sustain the stretch. And then inhale, slide your hand back up. Make your feet parallel and rest. This adaptation of Utthita Trikonasana is specifically designed to strengthen and at the same time paradoxically relax the muscles of the neck using the alternation of contraction and stretching of the muscle fibers known as PNF, or proprioceptive neuromuscular facilitation. Please spread your feet and then turn your left foot out, and inhale, raise your arms out to the side. And we'll start by exhaling, going down, slightly bend the knee and turn your head up to the right hand. Now, as you inhale, you'll bring the right arm forward and look forward, stretching the lats and the intercostals. As you exhale, you'll take the arm behind you and turn your head down. This is stretching the muscles in the neck. As you inhale, you'll bring the arm forward, look forward. So you're alternating up and down. Now we're looking up. Exhale, turn the head up as you bring the arm back. So those same muscles are now contracting. Inhale, bring the arm forward, look forward. Exhale, bring the arm back, look down, alternating. And then after several repetitions of this, we'll stay in this position, a few breaths, exhale, and you'll feel a deeper stretch because of the contractions that you did on alternate exhales. Now you can inhale, come up, arms out to the side, and exhale, lower your arms, turn your feet parallel, and rest. This variation of Bhujangasana is adapted to activate more effectively the musculature of the upper back. Dawn will demonstrate. Inhale, lift your chest, pulling back on the hands, slightly adduct the scapula, depress your shoulder girdle a bit. Exhale, go down about a halfway, slightly dropping the chin. And then inhale, pulling back on the hands, come back up all the way, again depressing the shoulder girdle back and adducting the scapula, lift the chin slightly. Exhale all the way down to the forehead. Take a free breath at the bottom, deep inhale, nice exhale. And once again, inhale, lift the chest, pulling back on the hands, pull the scapula towards each other as you pull the shoulder girdle down, depress the shoulder girdle. Exhale down a little bit, dropping the chin slightly. And again, pulling back on the hands on the next inhale, lift the chest, keep that shoulder girdle depressed and pull the shoulder blades towards each other. And exhale, come all the way down to your forehead. And relax. This version of Bhujangasana is adapted to stretch the neck and work the upper back. If you'll notice the starting point, Scott is turning his head to the left rather than on his forehead. Now please inhale, lift the chest and turn the head to the center, pulling the shoulder blades down and back. And now as you exhale and come down, turn your head fully to the right and relax the shoulders. And then inhale, come back up, turning the head to the center. Shoulders down and back, shoulder blades towards each other, and exhale, come down, turning the head to the left. We'll show one more time. You're alternating the head on successive exhales. Inhale, lift the chest, shoulders down and back, head up a little bit, and exhale, come down, look right, and rest. This adaptation of Bhujangasana is designed to mobilize the shoulder girdle and further stretch the neck. What you'll see is Scott's arms are folded behind his back, palms up, hands resting on the sacrum. As he inhales, he'll lift the arm he's looking towards and salute. Inhale up and salute with the right arm, turning the head to the center. And as he exhales, he's going to straighten the right arm and sweep it behind, turning the head left. Then he's going to inhale and salute with the left arm, head to the center. And as he goes down, he's going to be stretching between the left ear and the left shoulder, turning the head right and lowering the left arm. Inhale the right arm, head to the center. From this perspective, try to see what's happening between the right ear and the right shoulder as he lowers the arm and turns the head opposite. And one more time. Raise the left arm, salute, head to the center, and lower the left arm as you look right. And relax the shoulders and rest. This stronger adaptation of Bhujangasana is designed to strengthen the upper back and the rhomboids, the shoulder girdle, and to support the flattening of the thoracic kyphosis. Notice Scott's beginning again with his arms behind his back, palms up, hands on the sacrum, head to one side. Please inhale, raise both arms forward and up. Lift the head a little bit. And as you exhale, bend both elbows, drop the chin a little bit, but lift the chest higher. This helps you flatten the upper back and raise higher. Inhale, extend the arms. And exhale, lower the arms and look to the left. And at the bottom, relax the shoulders and take a free breath. And on the next inhale, again, raise the arms all the way forward, head up a little bit. Exhale, bend the elbows, lift the chest higher, drop the chin a little bit, palms high. Inhale, raise the arms forward. And exhale, sweep the arms behind you, head to the right, shoulders relaxed, take a free breath, and rest. This is an adaptation of Dvipadapidam designed to stretch the neck and shoulders, which Dawn will now demonstrate. As she inhales, she'll raise her pelvis and her right arm over her head to the floor behind her. And as she exhales, she's going to lower the pelvis, simultaneously lowering her right arm and rolling her head fully to the left. All these actions coordinated as she comes down vertebra by vertebra, stretching the right side of her neck and shoulders. As she inhales, she'll raise her left arm, rolling her head to the center as she raises the pelvis. And then on exhale, she'll lower her left arm simultaneous to rolling her head fully to the right, as you can see, stretching nicely the left side of her neck and shoulders. Let your head come to the center, please. This variation of Dvipadapidam is adapted to work the upper back in a very special way. Raise your arms, please, and interlock your fingers with your palms facing your torso and your hands quite open. Now, relax your elbows and inhale, raise your pelvis towards the ceiling. Now, just before you begin to exhale down, begin to extend the elbows, abducting your scapula, pulling your scapula away from each other, and roll down across the upper back. You get access to roll in the upper back. At the end of the exhale, relax the arms and inhale back up. Just before you begin to exhale down, begin to extend the arms, abducting the scapula, pulling the scapula away from each other, and rolling down across the spine. We'll do this one more time. At the end of the exhale, relax your arms and inhale up. Bend your elbows a bit. And now exhale. Abduct the scapula, reaching the fingertips towards the ceiling, stretching the shoulders away from the spine and roll down across the upper back. This variation of Urdhva Prasarita Padasana is designed to stretch the upper back. In fact, often I call this the medieval rack. It really stretches the whole spine, creating axial extension, but it's particularly good for the upper back and shoulders. Please bring your knees up towards your chest, and inhale, raise the heels and the arms, and feel the whole spine extended. Feel the axial extension. And exhale, lower the arms and bend the knees. And we'll repeat that again. Inhale, pressing the low back down as you extend the heels upward and stretch the fingers over your head, and exhale. You'll repeat this several times, and then you'll stay in this way. Scott will show you, interlock your fingers, palms out, and on exhale, slightly bend your knees and elbows, just slightly, just to back off the stretch, and take a nice long inhale and slowly Extend the arms and extend the legs. Feel that medieval rack. Feel the axial extension. Exhale, flex the knees and elbows. Inhale, extend. And then release and exhale, lower the arms and bend the knees. And then one foot and then the other on the floor. And relax. This variation of Jatara Parivritti is adapted specifically for the neck and shoulders. Please bring your left knee all the way to the chest. Bring your arms a little further out to the side. Inhale. And as you exhale, twist, bringing your left knee towards the floor on the right side. A little further. Even if the shoulder lifts a little bit, don't come too far. Keep the palm down. Inhale, come back up. You'll repeat this several times. We'll just do it one more time now. Exhale down. This twists across the left hip abductor and stretches into the upper back. Inhale, come up. After several repetitions, exhale down and place your right hand on your left knee. This next version is for the shoulder and the neck. Inhale, raise the left arm up, palm up, head to the center, and exhale. As you lower the left arm, turn the palm down and roll the head to the right. Classic variation, you look to the left, but here we're adapting looking to the right to stretch the neck. Inhale, raise the arm, palm up, head to the center, and exhale, lower the arm, palm down, look to the right, stretch the left side of the neck. Inhale, raise the arm one more time. This works in the rhomboids, in the latissimus dorsi. Exhale down and stretches the muscles, the deep muscles of the neck. And now we'll stay down. Inhale, keep that shoulder down, palm down. And exhale, push your fingers further away from your shoulder and turning your head further to the right. And stretch nicely the neck. Inhale. And exhale, push this shoulder down and look to the right. Feel the stretch in the neck. And then inhale, come up, head to the center. And exhale, bring the right knee up. And inhale, take the left leg flat. I'll have Scott relax, but you'll get ready to do the other side. This simple posture, known as Apanasana, is a very important forward bend used to prepare and compensate for other postures, and often used in transition, is very good for the low back. Dawn will demonstrate. She'll pick one foot up off the floor and then the other, and then put her hands on each knee. Notice that she does not clasp her fingers, but each hand holds each knee separately with the fingers pointing down towards the feet. She'll stay in this position as she inhales, and then as she exhales, she'll bend the elbows and pull the thighs towards the belly, keeping the low back and sacrum on the floor and keeping the chin down and the upper back and neck long. As she inhales, she straightens her arms, taking her thighs arm's distance from her belly. And again, as she exhales, she bends the elbows, pulls the thighs towards the belly, chin down, upper back and neck long, low back and sacrum on the floor. And then inhales, the arm straight. This variation of Janu Shirshasana is adapted to work the muscles of the upper back and the shoulder girdle. Please bring your right knee into Janu Shirshasana. Pull the right foot along the inner left thigh, heel in towards the groin. Inhale, raise both arms forward and up. And exhale, let the left knee bend liberally as you bend forward to facilitate bringing your belly and chest to the thighs. Then inhale, slide your hands up a little bit, lift your chest, but important is to depress and adduct, depress the shoulder girdle, adduct the scapula, then exhale, sink. As you sink, you can slide your hands further forward. And then as you inhale, lead with the chest, lift the chest away from the thighs, drop your shoulders and bring your scapula towards each other. And exhale, sink. This has a lot of value for the shoulder girdle and its placement in the upper back. Inhale, drop the shoulders and adduct the scapula. And exhale, sink. And then inhale, raise your arms forward and come all the way up. And lower your arms and rest. Now let's see the same posture from a different perspective so you can see more of the action in the upper back and scapula. Let's shift position. Inhale, raise your arms. And exhale, bend forward. Now as you inhale, depress the shoulder girdle and adduct the scapula. Pull the scapula towards each other. Feel the action in the upper back and shoulders. Exhale, sink down. Again, slide the hands up as you lead with the chest, up the leg, depress the shoulder girdle, adduct the scapula, and exhale, sink. This brings a lot of work and circulation to the upper back and shoulders. And inhale one last time, and exhale, sink. That's beautifully done. And then inhale, raise your arms, come back to the starting position, lower your arms. Put that leg forward and get ready to do the other side. This is a variation of Janu Shirshasana, adapted very specifically to work the relationship between the shoulder girdle and the upper back, stretching the scapula away from the spine and the ribs. It also has particular benefit for the neck. Please bring your left leg into Janu Shirshasana and then extend your right arm over the top of the right foot. Please feel free to bend your knee liberally. This is not about the hamstring. Take your left arm behind your back. The action of this posture is to inhale, and then as you exhale, to point the right toe and twist your shoulders left and look left and roll your left arm out. See the stretch that happens between the scapula and the spine. Inhale, look to the center, unpoint your toe, unroll the left arm. Exhale, point your toe, externally rotate the left arm, twist left, look left, stretch between the scapula and the spine on the right side. Inhale, unwind the spine, unflex, unpoint the toe, and exhale. Breathe deeply, stretch, and inhale, and exhale. And one more time, and exhale. Inhale back to the center. Put both feet forward and rest. This adaptation of Janu Shirshasana, slightly stronger than the previous one, is adapted to adjust the relationship between the shoulder girdles, scapula in particular, the rib cage and the spine. Please bring your left knee into Janu Shirshasana, your left foot along the inner right thigh. As you inhale, raise both arms up over your head. As you exhale, bring both hands down to the right foot. Liberally bend the right knee. Again, it's not about the hamstring. And inhale, lift the chest and flatten the back and raise the left arm up. Then as you exhale, point the right toe, twist over your left shoulder, left arm rotating externally, turn your head and look over the left shoulder. Beautiful. Inhale, untwist, raising that left arm back arched, and exhale, sink. And we'll repeat that. Take the hand to the foot and inhale, raise the upper back, lift the left hand, arch the upper back. Exhale, twist over your left shoulder, turning your head left, roll the left arm externally and point the right toe. Feel the stretch between the scapula and the spine. Inhale, raise the left arm, untwist the spine, but keep the back lifted. And exhale, sink back into Janu Shirshasana. We'll show that one more time. Inhale, lift the chest, lift the left arm, arch the upper back. exhale, point the toe, twist over the left shoulder, left arm externally rotates, head twists left, feel the stretch. Inhale back to the center, raising the left arm, upper back arched, and then exhale, go down, take the left hand to the right foot, and this time we'll stay in Janu Shirshasana a few breaths. Inhale, feel the chest lengthening away from the thigh, and exhale, sink from your waist a little lower. And inhale, one more breath here for this demonstration. Exhale, sink. And then inhale, raise both arms, arching the upper back as you come up. And then exhale, lower the arms and extend your left foot forward. And rest. This adaptation of Paschimottanasana is designed to energize the upper back, again work the rhomboids, adjusting the relationship between the shoulder girdle and the upper back, also to give a better support for the neck. Inhale, raise both arms, and exhale, bending forward. Bend the knees liberally. Again, this is about the upper back, not about the hamstrings or even about stretching the low back particularly. As you inhale, lift the chest, slide the hands back the legs a little bit, back along the legs, but adduct the scapula and depress the shoulder girdle. Let's drop the shoulder girdle down, adduct the scapula, then exhale, sink. The scapula abduct, the upper back stretches. And then inhale again, lean back, pull the chest up, adduct the scapula, depress the shoulder girdle, and exhale, sink. Allow the scapula to abduct and the upper back lengthens and stretches. One more time, please. Inhale, lift from the chest, adduct the scapula, keep that shoulder girdle depressed, and exhale, sink. And now stay down a few breaths. As you're down there, as you inhale, still feel the ribcage pull forward away from the pelvis and sink a bit from your waist. Feel the rounded quality of the back, the stretching in the back muscles, the relaxation of the upper back and neck. And then inhale, come all the way up. Lower your arms and rest. This version of Sukhasana Parivritti is adapted in order to maximize the stretching of the muscles that attach the head through the neck to the shoulder girdle and upper back. Please put your left hand on your right knee and your right hand on the floor behind you, slightly rotated externally. Inhale, and as you exhale, twist over your right shoulder. You can start by looking right. So you feel this movement twisting to the right. Then inhale, and on the next exhale, keep twisting right, but roll your head to the left. All the way to the left. And what we're looking for, stay there and inhale, and as you exhale, move that shoulder right and keep moving that head left, and isolate and feel the stretching on the right face of the neck, all the way down into the shoulder. Inhale, feel like you're getting taller. And exhale, twist further, move the shoulder further right, head further left, so that on that inhale you can slightly get longer and unwind slightly, and exhale, twist further. And one more breath. As you exhale, twist your shoulder right, look your head left, feel the stretch from the right ear all the way down the side of the neck into the right shoulder. And then inhale, come back to the center, put both hands on both knees, and rest.